Hi, I'm Dr. James. I'll be having a little talk with you about sexually transmitted infection and safe sex practices. Alright? So I'll let you come with me. By way of introduction, sexually transmitted infection is one of the commonest gynecological presentations in our day-to-day clinic activities. It's been seen among women of childbearing age, young school adults, and female adolescents, right? There are various organisms that have been implicated in this condition, which could range from viral, bacteria, protozoa, and fungal infections. Viral causes have been seen as things like human papilloma virus, like serotype 11, 6 and 11, causing genital warts, 16 and 18, implicated in majority of the cases of cervical cancer. Bacterial causes have been seen as things like Trichomonas vaginalis, Chlamydia trachomatis, Neisseria gonorrhea, and the things like Treponema pallidum causing syphilitic ulcers and infections. Right? Protozoa parasites like Trichomonas vaginalis have also been seen, while infections with Candida albicans have been seen as fungal causes. There are various clinical presentations in this condition, but we will focus more on the major presentations in this kind of condition, which range from the patient may present with abnormal pattern of bleeding, right? Which could range from heavy menstrual bleeding, prolonged menstrual bleeding, intermenstrual bleeding, and as well postcoital bleeding as well. They could also complain of low abdominal pain. There could also be presentations of foul-smelling vaginal discharge, which could be purulent, watery, greenish yellowish coloration as well, and could be vulvar itching, vaginal itching, and vulvar itching. Patient could also present with fever, anemic as well. There could be ulcers, like seen in syphilitic ulcers, which are chancre, that are painless, which could be differentiated from ulcers of Hemophilus ducrei, which are chancroid and they are painful. Right? There are various investigations whereby this clinician could also send patients for, which could range from, could be seen as full blood count. Patient may be anemic. There could be leukocytosis, WBC, white blood cell count of neutrophil predominance, bacteria, or lymphocyte predominance if it's viral. The physician can also send for things like eye vaginal swab MCS, urine microscopy culture and sensitivity test, endocervical swab MCS, and even HIV 1 and 2 screening, and the hepatitis B, C, and T viral markers as well. Findings from these investigations, including both pelvic ultrasound, which could also show pelvic collection, tubal ovarian abscess, could also show the extent of the disease and help the physician to know the course of management of this patient. By the treatment, I won't want to bore you with the treatment because that will be left at the discretion of your physicians, alright? But things like Chlamydia trachomatis infection, whereby there could be purulent cervicitis seen, and most implicated in destruction of the ciliary tubes. First line drugs of doxycycline have been seen. Second line azithromycin. Ceftriaxone could also be used, and the patient could also be treated with highly active antiretroviral therapy after counseling and testing of the patient. Right? Then there are various complications with this infection, which can be seen as chronic pelvic pain, whereby patients keep complaining of pain all the time. This could be as a result of chronic pelvic inflammatory disease. There could even be tubal ovarian abscess, which has seen as a complication. There could even be frozen pelvis, whereby all the structures of the pelvis are matted down together. The anatomy of the pelvis is no longer well defined. All right. So, and there could even be infertility with the destruction of the ciliary movement of the tube. That could lead to infertility. There could even be sepsis, overwhelming sepsis, whereby the infection seeps into the bloodstream and causes sepsis, and the patient could even lead to death of the patient. In summary, sexually transmitted infection is of public health importance. Early treatment, partner notification and treatment is paramount to help avert these complications of this infection. Thank you. So we'll have a little talk about safe sex practices, alright? Where are various ways we can practice safe sex to prevent sexually transmitted infection, unwanted pregnancy, and even things like HIV infection. Alright? So I will say that you will need to practice abstinence. Try to abstain from premarital sex. Alright? Casual sex. So if you can't abstain from premarital sex or casual sex, then at least be faithful to a faithful partner, right? If you can't be faithful to a faithful partner, which I'm not advocating for that, at least try to use condom consistently, right? This will help to prevent sexually transmitted infection, things like HIV, unwanted pregnancy, and as well help you to live a healthy life and achieve your obstetric career. Thank you very much. We've come to the end of this. Stay positive, live a healthy life, and achieve your obstetric career. I'm still Dr. James, your doctor. Alright, see you next time. Please hit the subscribe or notification button for more updates of my lecture. Thank you.